It's a new day in modern dentistry. You can feel like yourself again with Shatkin Mini Dental Implants. Mini Dental Implants are the safe, fast, and cost-effective solution to many dental issues. Do you suffer with loose dentures? Are you afraid to smile or unable to eat the foods you love because you have missing or broken teeth? Mini Dental Implants are your affordable solution.
I've had problems with my teeth.
I couldn't eat almost anything.
I had this big hole in my mouth.
I knew it was time to do something permanent.
I'm gonna go and get this done.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
The mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's incredible. It is. It's absolutely incredible.
Hello, everybody. Welcome to Innovations in Health. John DeShula with you here, welcoming Dr. Diana Rodriguez, a dentist in practice for 12 years, currently in Union City, New Jersey, and serving really all of northern New Jersey. Welcome, Diana.
Hello, John. Thank you for having me.
You're welcome. Dr. Rodriguez, we're here today to talk about a brand new technique, mini dental implants. It's something that you are doing at your practice,
Yes.
and it can change people's lives. Explain what it is.
So mini dental implant is a type of implant that is minimally invasive. Mini refers to the diameter of the implant. So we can, in most cases, place these non-surgically, which patients love to hear. We just make a small pinhole in the gum, and through that pinhole, we just thread the implant right into the bone.
And this mini dental implant is something that can be used on someone who has already a denture in place, but it really moves them so far along. It's so much better than the standard denture.
Right. So what we can do is if a patient comes in with a poorly fitting denture, we can place 4 implants, and then their denture will snap right into those implants.
That's amazing. It just takes that and connects it right to the gum.
Right. So you could have a patient that is not able to eat a lot of foods, and within an hour they can go home and resume what is a normal diet.
And that's what's so amazing about the mini dental implant technique. It just doesn't take that long.
Yep. So what I like to tell the patient is that I can replace that tooth faster than I can do a root canal, do a filling, clean your teeth.
When someone comes in for a consultation and they sit with you, how do you explain the mini dental implant based on their dental situation?
Typically, I'll use a model to explain it to the patient. And what I explain to them is that we will give them some Novocaine just as if they were having a filling done. And we make a small opening in the gum, thread the implant into the bone via that small opening. And then once that implant is in place, we can go ahead and place either a temporary crown or a permanent crown. So if a patient is missing multiple teeth, once we've studied the case, we can place the implants just via a small pinhole in the gum. We thread the implants into place. And what's great about the mini implants is that immediately they're anchored into the bone. We don't have to wait for any healing. With mini implants, they integrate immediately. And that is why we can place the crown or the bridge at that same visit.
Within a few hours, they're home.
Yep.
And perhaps maybe a Tylenol overnight will make them feel just a touch better.
Most patients will just take Tylenol, Motrin.
What has been the reception to this when you tell your patients about what this can do for them?
Well, most patients are shocked. It's new in my practice, but it's not a new technique entirely. This is something that we've been doing now in dentistry for the past 16, 17 years.
And you have a very interesting practice where you're based, and it's bilingual practice as well, so that the patients come in, they really are able to connect with you.
Yes, I work very hard on establishing that patient relationship and tailoring a solution for each patient. And most times I like to give each patient multiple solutions at different price points so they can choose the option that is most affordable and really best for them.
This is something that you're going to work with the patient to make it work for them.
So what most patients decide to do is work with a financing company that we offer in the office. And basically, it's a very simple application. And right away, within 3-4 minutes, we will know whether the patient is approved for the financing, that's interest-free, then we can just go ahead and get started at that same visit.
And I think it's great, Dr. Rodriguez, because you're able to really connect with your patients. I think that's what's so important for somebody who's out there watching in northern New Jersey, that they can come to you at your practice.
Yep.
And they really will create a connection with you because you really have that extra special effort that you're going to make their visit comfortable. And it's general dentistry that you practice as well.
Yep, we practice general dentistry, anything from, gum therapy if their gums need help, to root canals, crowns, bridges, dentures, mini implants, obviously, Invisalign.
Where is your office?
We are on Bergen Line Avenue in Union City, New Jersey.
When you got started in dentistry, we were talking before the program, there aren't that many women in dentistry, but you were inspired by a woman dentist.
Yes, my dentist, who I started out assisting her, I believe, when I was in high school.
You have some very interesting stories because the patients that you've dealt with have had a life-changing experience as a result of going to your practice.
Yep, one patient that comes to mind is a patient of mine. Originally, she came to us through her husband. Her husband had come in for an emergency and went home and told her about the office. And she had been to see several dentists because she had a lower partial denture, which was removable. She couldn't get used to it. It would make her gag. So she was having a lot of difficulty chewing her food. So she kind of came in as kind of like a last attempt. I've heard multiple times that I'm not a candidate for implants. I don't have enough bone. But, what do you think? My husband thought you were really nice, so I'll just come in and get your opinion. And when she sat in the chair, she did have very limited bone. However, she was definitely a candidate for mini implants. So we went ahead, took the necessary x-rays, the impressions, studied the case, and then we went ahead and replaced all the teeth that she was missing on the lower right side of her mouth. And she was so happy that a couple weeks later she came back and we went ahead and replaced the teeth that she was missing on the lower left.
That's amazing. And, we're talking about patients that might be a little bit older, but the mini dental implant and the procedure is something that a patient of any age can experience if they have a lost tooth or they have some issue going on with their mouth. Age is not really a factor. This is something that anybody can enjoy.
Right. So I completed this procedure on my grandmother recently, and she's 85. She was just in shock with the procedure. She just couldn't get over, how it was so painless and easy and quick.
I had my procedure a few months ago, and it went great. No problem. I love them. I truly thought that it would be very, very painful. And I was amazed that it only took a little over an hour. And when I went home, I could basically eat everything again. Everyone notices, that I smile more and my confidence is better now than it ever has been. And they're amazed how it changed my whole life.
So this is what we call the Fix on 6 procedure, with as little as anywhere between 6 and 8 implants on the upper. We can replace the entire arch of missing teeth. Most times denture wearers are frustrated. There's a lot of foods they cannot eat. So this is a great option because now their palate is exposed. There's basically nothing touching the gum tissue, and they can really go from not being able to eat a lot of foods to speaking with confidence, engaging in different social situations with confidence,
Sure.
chewing, eating whatever foods they want. Hi, I'm Dr. Diana Rodriguez.
Dr. Rodriguez serves Union City and northern New Jersey using a modern and gentle approach to dentistry. A leader in affordable mini dental implant procedures, Dr. Rodriguez has changed the lives of her patients who suffer with loose dentures or missing teeth. Dr. Rodriguez and her staff pride themselves on providing the best possible services using the latest technology so you'll leave her office happy and satisfied.
Call me today for your free consultation. Let me create your winning smile.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again.
How could you go wrong?
I just can't say enough about how I feel.
able to talk and speak with confidence again.
It's one of the best things I've ever done in my lifetime. I mean it sincerely.
When I go to the VA, I can give them a big old smile.
This is something that is so incredible.
I feel a lot more confident. My smile feels better.
It brought a lot of confidence back to me.
It's just amazing what it does for your self-confidence and how you feel about yourself.
After the procedure, wow, yeah, you smile.
But now I smile all the time.
I am very happy I had the procedure done. I feel as though I have my smile back.
It's just unbelievable what it's done for my life.
It kind of gave me my life back.
I feel like I do have more confidence than I did before.
It's going to sound corny, but I mean, it is a life-changing event.
Changed my life.
Another patient that I could tell you about, John, is a patient that came to me after having had a denture made by another dentist. And when he came into the office, he had the denture in his pocket. It was his upper denture, and he was just walking around without teeth. He was on a pureed diet. So you're talking about a grown man that really could pretty much eat soup, mashed potatoes.
How long was he like that?
He was, I would say, it was probably several years that he was like that.
I've been blessed with bad teeth all my life, some of which I caused myself because I knocked my teeth out playing football in high school. So I've added to the problems. So the implants or the partials that I had to be adjusted and added on to over the years. It got to the point where I can't even remember how long it's been that I could bite into an apple. I would have to cut it and then try and eat it that way. At the end, it was getting difficult to bite into a sandwich or a steak. Met with me, took the time, gave me options for what I could do, and we decided to do the routine of trying to do mini implants. First, we replaced my bottom partial with mini implants, and then as we got going, ultimately I lost and replaced the upper partial with mini implants. Now, for the first time, and I honestly can't tell you how long, I can bite into an apple like what I call a normal person. Doesn't bother me to eat anything. I can eat steak, I can eat sandwiches. And I think one of the most important things is I've gotten, my self-esteem back, because I used to be embarrassed to think that I'd go somewhere and especially even getting your teeth cleaned, I'd have to take out the pieces and give them to them. So it's made a tremendous difference in the quality of life I have and just the ability to eat.
And he went from being someone who really had a very limited diet to someone that could go to any restaurant and order anything off the menu.
So when this happens and you're able to put the mini dental implant into the patient's mouth, is there a longevity issue? And how would someone care for their mini dental implant?
It's going to last them a very long time. It's hard to put a number on that, but I would say it is going to be a long time. In terms of caring for the implants and the prosthesis, it's, normal brush, floss. We give each patient a water pick so they can keep everything very clean. We encourage that they come in on a routine basis, just like they would if they had natural dentition.
What would motivate somebody to want to come to see you?
One patient that comes to mind is a patient that came into our office because she was starting a new job in 2 weeks, and she had she was missing a tooth on the upper right behind her canine, and she said to me, I cannot start this new job with this missing tooth. It's just so embarrassing to me. And what I did for her was we went ahead and did the CAT scan right in the office, and she did have limited bone, but it was enough bone to place the mini implant. And really at that point, her only question for me was, well, how soon can you do this? Because I start this new job in 2 weeks. So we went ahead and placed the implant at that visit, and I placed a temporary crown, and 2 weeks later she had the permanent crown, and she was just ecstatic.
That fast?
That fast.
Have you heard back from a lot of these patients about how the mini dental implant has changed their attitude and changed their life?
I see these patients on a routine basis, and all of them are very satisfied.
I highly recommend them. I'm totally pleasantly surprised at this whole dental experience here.
Very happy with it. It looks natural, it feels natural.
I do smile a lot now.
It was done, over, done. Let's go home and eat.
Would I do this again? Yes.
And my teeth aren't falling out of my mouth.
I'm very, very pleased that I have them now.
So I did it, and I'm very happy with it.
Many dental implants have changed my life.
An interesting technique, and it's a technique that you have invested a lot of your time in learning to get the latest information possible that, that you bring back. Talk to me about that process and how you've been able to become educated in the mini dental implant.
So what was happening in my practice, my patients were coming to me and telling me, Dr. Rodriguez, I need an implant. And I would tell them, well, okay, you have to go see the surgeon. And then after you see the surgeon, well, then you'll come back here 6 to 8 months later and I'll place the crown. And what they were telling me was that they did not want to go to the surgeon, that they wanted me to do it here in my office. And eventually I came across Dr. Shatkin's course in Buffalo, New York. And I was just in shock with, you know, the material that he was teaching and the procedure. And I just thought, well, this would be something that would be great for my patients. And I could keep everything in-house, and which is exactly what my patients were looking for.
Well, I know Dr. Shatkin has instructed many, many dentists across the nation, and now here in northern New Jersey, you are the beneficiary of all of that expertise, and I know he thinks very highly of you, which is wonderful, and so our viewers are knowing that not only Dr. Rodriguez, but there's a whole staff and a whole team of people who are there to make sure that that mini dental implant is just right. And Dr. Rodriguez, I understand you have a new dentist working with you. Let's take a moment to meet Dr. Samuel Lemieux.
So I'm from Kansas City, Kansas, and I grew up, went to school at the University of Kansas, and then eventually went to Boston for dental school at Tufts University. So my father is a dentist. I've learned a lot working with my dad, and I've been in the dental business now for 12 years. My favorite part of being the dentist is being able to help people, and that satisfaction a patient gets when they come in, they put their trust in you, and then you deliver the work, and that joy that they have, that they made the right choice in putting their trust in you, and then just the satisfaction of helping people. In dental school, we're mainly taught conventional sized implants, and it's almost like a secret that these oral surgeons who are teaching you, they just give you a little bit of detail, and it's a 1 3-hour course for a semester. So the amount of knowledge that you're shared with, it's great knowledge, but you just want more. And I actually went to school with Dr. Jared Shatkin. So his dad, Dr. Todd Shatkin, was around, and I was blown away by these other options, these one-piece implants of varying sizes. And the surgery, I was blown away by the ease for the dentist, for the clinician, and the patient. Ever since then, I started working with Dr. Diana Rodriguez, and she's been the greatest mentor I could ask for. Got her by my side, and she's basically taught me everything I know. I always tell her, I think I've learned more in 6 months here with you than I did in all 4 years of dental school. First of all, I think most people get introduced to mini dental implants via lower denture stabilization. And that's my favorite treatment to do on patients. People come in suffering for years and years of a loose lower denture. They have it remade 100 times, relined, and it just never fits right in their mouth. They'll be talking, they'll be laughing, it'll pop out. It's the quickest appointment that we can do to really change someone's life. Could take them from about 10% function to 60%. That 50% jump is massive in terms of being able to eat, laugh, talk without the fear of people around you knowing that these are false teeth. Secondly, being able to restore just missing teeth patients have. Someone comes in and they broke off their front tooth, being able to that same day take that tooth out, place an implant, and give them a temporary that in the past would have been nearly impossible. So I absolutely love being here in Union City, serving the patients. If you are having any dental issues, any discomfort in your mouth, or if you have a problem that you just haven't been able to solve, call for your free consultation at our office. That includes a dental x-ray, an examination, and a full treatment plan for free.
What motivated you to become a dentist besides that inspiration? What is it about the patient doctor connection that really stimulates you?
I'm the type of person that likes to see a problem or an issue in someone's mouth and be able to fix it right away.
Now, someone who might be watching this may have a dentist that they're already going to, somebody that they've maybe in the family, or they just, you know, it's a natural course of their life been going to. How would you offer some advice to that patient, potential patient, to say, no, you can come over and see me in Union City? I mean,
right. So I like to direct patients to our website, and obviously we offer a complimentary consultation. So there are a lot of patients out there that like to do their homework ahead of time. So if they want to go onto our website and take a look at our website, and then they can just give us a call and schedule that free consultation.
And on that website, a potential patient or your current patients can learn all about the mini dental implant and the other services that you offer.
Yes.
And Dr. Diana, we wanted to educate the public in the affordability of this. And the mini dental implant is something that is so innovative and so terrific, and it's an American-made product, by the way. We should mention that. So the tooth that you will have and the implants that you will have are made right here in the United States, and it's something that really is going to look good. It's going to be shaped and colored to match the rest of your mouth.
Yeah, and what I also always tell my patients is that mini dental implants are less than half the cost of conventional implants.
The metal piece that is there and it's placed in the gum, when we say minimally invasive, you know, and when people see that, they think, well, is it really that minimally invasive? Is that pain really as minimal as we describe? But it truly is. It's not a lot of effort to get that in place.
The only thing they're going to feel is a slight pinch from the needle, just as if they were going to have filling done. And then after that, the only thing they feel is the pressure from me working in their mouth, and that's it.
So as we're educating the public, and that's what you want to do, and that's why we're here today, to really make sure that the public out there in northern New Jersey is educated about this. And when they come to you, does somebody then maybe offer an objection to it and say, no, it isn't right for me, or based on some of the things we just discussed? And how would you address that if somebody says, no, I don't want to do that?
You know, there are some patients that feel that way, so we try to offer, another option. Really, I feel the only thing I can do is work on educating the patient and giving them all the information and let them make the decision. But based on all of my education, I really do feel that this is the best procedure, and that's why I have done it the best option, and that's why I've done it on family members, and I always present it as the most minimally invasive and atraumatic procedure available to replace their missing teeth, whether it's one tooth, whether it's multiple teeth.
Let's talk about your education. Let's get a little bit of the background of Dr. Diana Rodriguez so our viewers can get to know you a little bit. Where did you study your dentistry?
So I graduated in 2004 from Tufts University, and I stayed for 2 years after that in Massachusetts practicing general dentistry. After that, I moved back to New Jersey, and I worked as an associate in several different practices. And then in 2012, I decided to open my own practice.
Somebody that is coming to your practice is getting a world-class procedure right in your office.
Right in their backyard.
Right in their backyard, so you don't have to travel long distances. You don't maybe have to pay a rate that might be a little bit higher some other place.
Right.
And I think that's what's very interesting. And you do have that connection, with your patients.
Yes.
And once again, where are you located? So if somebody's out there now and they've learned about the mini dental implant and now they're motivated to connect with you, how would they do that?
Call our office. They can schedule their appointment online via our website if they wanted to.
And now that we've learned all about this, and I'm going to go back to the models one more time, let's go through them once more so that the viewer out there can really take a look. So if they have a denture, how would that change their life, a conventional denture?
So if the patient has most of the time it's the lower denture that the patient is struggling with the most, but we can stabilize both. So what we can do sometimes is we can use the patient's own denture. In that case, we can do this procedure in just 1 hour. And so we would place the 4 implants, and then a O-ring housing goes inside their existing denture, and that is what allows for the denture to snap right onto those implants.
And so you can take the denture in or out based on your own convenience.
They take the denture out a couple times a day to clean the implants. A lot of these patients will sleep with the denture in, which is fine.
And it's a secure
piece. You can hear that tight fit because that's the O-ring housing that's locking the denture into place.
So the patient should really understand that this is something that's going to last. This is something where that is not going to slip out.
Right. The O-rings do have to be replaced approximately once a year. The patient may feel that it's not fitting as tight, the denture, in which case they come in, and that's something that we do right in the office. We can just pop these O-rings out and pop new ones in.
Part of the general routine maintenance.
Exactly.
In addition to the cleaning.
Right.
So that's the denture. Now let's talk about, again, the set of teeth and how the porcelains would work.
In this case, we have what we call a roundhouse. And so we've placed about 12 implants. Most of the time, what the patient gets is a temporary bridge. And at that same visit, we'll take the impression to fabricate the final bridge. And within a few visits, the patient will get their final bridge. This is as hard as diamonds, this material. There's nothing touching their palate, so they're able to taste their foods, feel the hot and cold. And this is a phenomenal option for patients that have an existing denture that's fitting poorly. This is really like their third set of teeth.
And it makes the full set of teeth look so good, too, in addition to what you're able to bring to the table.
The zirconia looks phenomenal.
Yeah. Mm-hmm. And then I have a tooth in the back. It's fallen out. I need some help. There are a few teeth that are not right. Don't neglect them.
In the case of multiple missing teeth, what we do is we can place the implants, and in some cases we have the bridge made ahead of time, and at that same visit we can cement the bridge right onto the implants.
And that's just a few teeth, and that could be in a situation where a tooth is lost or a tooth is decayed. So you'll work with the patient, but the front teeth remain the same and the rest of the mouth is in place. It's just a few teeth that need the dental implant.
Exactly.
Yeah. And finally, a single tooth, not difficult.
No, what we do in the case of a single tooth is, well, the patient comes in, I discuss with them what their options are, whether it's the bridge or the mini implant and the crown. In most cases, I try to steer them in the direction of the mini implant and crown so that we don't have to touch those adjacent teeth. Because if the adjacent teeth are in excellent condition, I really do prefer not to touch them, because sometimes they develop a problem with those adjacent teeth in the future. They'll most likely lose the whole bridge. So that's why if those adjacent teeth are in good condition, I just prefer not to touch them. So what I explain to the patient is that we will go ahead and do the CAT scan, take the necessary impressions, and within 2 weeks, they will come back, have the implant placed, and the crown will be cemented at that same visit.
So the process from the consultation to the actual dental implant is not that long.
No.
And then the actual procedure is very brief.
Very quick. If the patient comes in at 9 o'clock in the morning and it's a single missing tooth, usually by 9:30, we're done.
That's it's the lightning speed.
Exactly.
And because you have the latest technology in your office in Union City, this is how the mini dental implant will work in your practice.
Exactly.
Well, Dr. Diana Rodriguez, it's been a pleasure to have you here.
Thank you,
You are
John.
an innovator in health, and everyone in northern New Jersey, we hope you've been educated in what the mini dental implant is all about, how it can change your life, and how, most importantly, going to see Dr. Diana Rodriguez can really make that experience a much more personal dental experience. It's not something that's going to be hard, difficult, painful. It's going to be something where you will work with that patient, not only on the care, but on the affordability.
Yes.
Well, congratulations on all of your success. And we hope that all of our patients now out there watching will come to you, and they too will have a beautiful smile just like you.
Yes.
All right, Dr. Diana Rodriguez, thank you for joining us.
Thank you.